And Dave.
You know, my wife and I were just talking the other day, and we realized that the date that Back to the Future had listed as the future, we've actually passed it. We've already had that date in 2015. A little scary. So when we talk about telemedicine, it's something that I would envision something that's going to take place in like 2030 or something like that. But Jake, it's already here, isn't it?
It is here.
That's fantastic. We're talking with Jake Garfinkel, the CEO of Telemedico. Jake, welcome to Get Down to Business. Tell us a little bit about what you're doing to revolutionize the healthcare industry.
Thanks. Glad to be here. Let's start off with a quick definition of what telemedicine is. We connect healthcare providers and patients online for face-to-face video appointments. Our target market right now is the rural areas of Illinois because we have found that the availability of specialists, the scheduling availability, and the travel time for physicians to get to their patients has been a problem.
So let's start with the basics. What is rural? Who defines what a rural community is?
So there is no real specific definition of
my friends in downtown Chicago believe that Skokie is rural. They're wrong, I believe.
Yes, and Rockford, Illinois is also not considered rural. What we have found is that they are counties and villages within the counties of less than 20,000 residents in a specific square mile radius.
And those areas probably are not served very well by many physicians.
Correct.
Interesting. So telemedicine connects those communities and perhaps the long-term care patients that are in that area with physicians that they might otherwise not have access to or might not be able to visit with them frequently.
That is correct.
Interesting. So tell us a little bit about the technology behind it.
Sure. So we are, what the last segment spoke about, is a cloud-based technology platform that seamlessly and securely through our HIPAA securities connects these individuals for a face-to-face encounter. So imagine a FaceTime or a Skype, but very, very secure. We are also acting as an electronic medical record. So besides having a face-to-face encounter, but we are able to store these patients' records securely. So if another physician or the same physician needs to come back in and do a visit, we have them all on record and organized appropriately.
So, oh my God, this is amazing. So if I have a family member that's somewhere near Carbondale, Illinois, and let's say they're in a what would be considered, as you said, a rural community, and they might need to be seen by perhaps their either their doctor from when they lived in the Chicago area, or perhaps a doctor that they might not have access to at Northwestern hospital in downtown Chicago. Are you saying that is possible?
That is possible, and that is definitely our goal. Our first goal is continuity of care. We want to connect you with your primary care physicians. The biggest problem even in the urban setting is, though, availability. That the average time it takes to make a doctor's appointment is 3 weeks. And the average clinic in the urban areas are open less than 40 hours a week. So that means if you are sick, you are running to the ER or to a Minute Clinic. But those physicians don't know you. We've created a way to connect with your primary care physician, what would be considered as off hours, but for necessarily a 15-minute encounter that he can then treat you and say, is it necessary for me to go to the ER?
So is this costing the patients a fortune of money?
Absolutely not. What's really nice about the rural communities is individuals 65 years or older who have Medicare Part B, Medicare is covering it. Private insurances are now also launching their own. So there was a commercial today from United Healthcare that you can now connect. If you are a United Healthcare insurer, you can connect to a United Healthcare physician who will then treat you. We are then also, as a startup, we are working closely with Medicare, but now over time we're trying to get contracts with the different insurance companies.
Fantastic. That's amazing. So again, this is not technology for 2030 or perhaps beyond. Or Jake, this is available now. Tell us, how far along are you in the process?
Sure. So we are open right now only to the private sector, specifically in long-term care facilities. We are trying to connect those patients to their physicians more frequently to help reduce 30-day readmissions of bouncing back to the hospital. And we are opening up a private psychology and psychiatry practice for individuals who are going through some issues of specifically divorce and counseling with their own doctors.
Is there any potential that this would be available to rural hospitals that might not have all the physicians that we're accustomed to here in the Chicagoland area?
That is definitely our goal. As we work with the skilled nursing facilities in the rural communities, we want to connect them with their healthcare providers. So at Telemedico, we are giving their primary care physicians at the rural hospitals free access to our platform to connect to their patients.
Fantastic. Amazing technology, and it's available now, which is really exciting. We are running out of time, but before I get to your contact info, our listeners can't see what's on your head, but what in the world are you wearing?
I am originally from Detroit. I apologize, all the Chicago people that are on the air. But I'm a longtime Detroiter, big Tigers fan. So
I won't hold it against you. We will have you back on to continue the conversation about the great technology of telemedicine. Jake Garfinkel of Telemedico, tell us how our listeners can reach you.
Our website is www.mytelemedico.com. Also, info@mytelemedico.com for email.
Fantastic. Really, really exciting stuff. As I said before, transforming the healthcare industry in a very, very positive way, bringing better access to rural and remote communities. Very exciting. We'll be sure to have Jake Garfinkel and his team back on Get Down to Business because we do like to follow startups and entrepreneurs. Get Down to Business is powered by Tandem HR, your solution center. You can find them at tandemhr.com or call 630-928-0510, 630-928-0510. You can also email them, simplify@tandemhr.com. And, talking about travel and talking about remote communities, many of us business people do have to travel a great deal, and I've got a lot of tips for you. So keep listening. I'm going to be sharing some of those tips on how to save money on business travel. And you can always get on my website, shalomklein.com. That's where you can download podcasts from shows like today with fantastic guests like Congressman Bob Dole, Mark Goodman of E-Commerce Solutions, Daniel Burns of Deep Blue Data, and Jake Garfinkel of Telemedico.